Okay, everybody, welcome to tonight's webinar. We're going to chat about calming supplements for horses, any science that's there, but really dig into questions you should be asking before we jump for a calming supplement or even, calming medications. I think oftentimes we jump too quickly to these substances when there might be something else going on that we could overlook if we don't investigate all avenues. So the questions that I tend to ask first, well, tell me about the horse's diet. What are you feeding the horse? Tell me about the type of food that you're feeding the horse. Is the horse fat or thin? What type of grains you might be feeding? Are you feeding a high fat, high fiber type diet, or is it high in non-structural carbohydrates? Sorry. Is it high in non-structural carbohydrates coming from things like cereal grains, corn, oats, barley, that kind of thing? Is my horse being exercised enough in relation to food intake? So are you overfeeding him and because you're trying to maybe get him to gain weight, but you don't want him to have too much energy? Or are you just feeding the wrong types of food? Is there enough fiber in his diet? If there's not enough fiber in his diet, well, we might get a whole slew of different things occurring. It might be causing some uncomfortable, like gut pains, which can alter behavior. You might see some colic-like symptoms, some loose manure also going along with altered behavior. Those of you, the DAC team that were with me last week in South Dakota when we talked about the microbiome, know that the microbiome, actually, that's the community of bugs that live in the horse's hindgut and in your gut for that matter, communicate with the brain. So a lot of behavioral changes or alterations in your horse start with the microbes in the gut. So you change the microbes and that 100% can alter their behavior. So that's why I'm kind of focusing a lot on what's going on in the diet. Is the horse spending too much time in a stall or stable? Are they confined? Maybe they're used to being exercising a lot or being out in a field, and then you go to a show and they're stuck in a stall. So usually you have turnout and now they're in a stall. And then you go to a show and their behavior changes. Well, there's a couple of things going on. There's probably a lot more kind of stimulation in the environment. There's a lot more horses around. There's different noises, but also you just put them in a stall and gave them a lot less exercise. So if we can narrow it down to that, maybe they don't actually need a calming supplement. They need to just do more exercise, whether it be lunging, whether it be hand walking. But I think being able to narrow down what is altering the behavior. Is it something we can change? Is it something that we have caused? Or do we need to call in a calming supplement then? Because ultimately, I don't want to set you up for failure. If a horse has gastric ulcers and it changes its behavior and it gets really cranky and unruly, and someone comes to you and says, I think I need a calming supplement, and they don't even investigate gastric ulcers, then you're going to give it a calming supplement. It's really not going to do anything. And then they're going to say, well, you sold me a calming supplement that does nothing for my horse. Well, no, it's still a good calming supplement. You just fed it in the wrong situation. No amount of calming supplement is going to take away the pain from gastric ulcers. So you kind of get where I'm going with that. You really need to make sure that you're feeding the correct product to fix the right issue. Is the barn or stable environment stressful? If you go to a show, you can't really change this, especially if you're at a fair and there's music and, rides and all kinds of stuff. But that could be what's changing the behavior. Is my horse's behavior due to pain, be it gut pain, muscle pain, hoof pain? skeletal pain. There's so many different sorts of pain. So we got to investigate that. Does a saddle or the bridle fit properly? What about the teeth? A lot of time, oh, they're shaking their head, or they don't want to take the bridle. They're running away. I think I need a calming supplement. Are their teeth being floated regularly? Is something gone awry in their mouth? I mean, all of these things we need to check off. Is this a new behavior? When did it start? And can we work out what caused it? Is there an outside trigger for this behavior? Is my horse losing weight? If we're losing weight, or there are other kind of physiological signs, that may lead us, maybe they've got some hair loss, maybe they've got some, I don't know, the white skin or the white markings on them, or getting sunburned. These might all indicate something else is going on. Are they showing classic ulcer-like symptoms? And we talk about the ulcer-like symptoms. It doesn't mean that they have to show all of those symptoms. It may only just be one or two. Is my mare's behavior due to her hormonal cycle? Does the behavior only occur at certain times? So we need to investigate all of these so that we can kind of pinpoint what it's causing. Then, can we correct that with a calming supplement? Is a calming supplement the right thing? Or should we be investigating something else? Okay, so if we determine that we want to look at we do want to in fact feed a calming supplement, what in a calming supplement is of use? So magnesium is one of the most common ingredients in a calming supplement. It's involved primarily in skeleton and muscle. Enzyme regulation, muscle contraction, helps to regulate calcium as well. It's absorbed in the small and large intestine. Now, magnesium sulfate in large doses has been used as an anesthetic. There's research done where they fed very, very large doses of magnesium, and it did act like acepromazine. Deficiencies in magnesium, and I think this is kind of where the whole fad of magnesium came from: nervousness, muscle tremors, incoordination. These are all signs of deficiency. I will tell you now that there is probably very few horses on the planet that are actually deficient in magnesium. That doesn't mean that adding additional magnesium to the diet can't help with some of these issues. It's like there are very few horses on this planet that are deficient in biotin, but we do know that adding additional biotin can also help with hoof quality. But feeding too much is also an issue. Excess compromises intestinal integrity. Okay, what is the thing that we are constantly fighting against when it comes to performance horses or exercising horses, horses that have stress? Stress, exercise, trailering, riding in the heat, any number of stressors. The first thing that gets affected is the gut lining. All right, and we end up with that leaky gut-like syndrome, because the gut lining is only one cell thick. So it's very, very easy to compromise that intestinal integrity. And excess amounts of magnesium can do that. So know that if you feed too much magnesium, you may be causing gut issues. Too much can block calcium uptake. It can block phosphorus uptake. Magnesium often used as calming supplement, but this can alter magnesium uptake if done too often as well. So magnesium is not just used as a calming supplement, but magnesium is used in all other tissues. And so we don't want to interfere with the uptake of magnesium so that it can't be used for muscle or tendon or cartilage development. Magnesium aspartate was the specific type of magnesium that the research was done on in 2015, and they actually looked at these kind of startle reflexes in the horses, and they were feeding either 2.5 grams or 10 grams And at 10 grams a day, which is excessive, there was elevated urinary calcium excretion. So we're dumping calcium out, but it did mimic for 0.04 milligrams per kilogram body weight of acepromazine. So that's a kind of standard dosing of acepromazine. So yes, very high doses of magnesium can have a strong calming effect, but at what cost? And are you just hiding or covering up underlying issues? So this is from the 2015 guidelines, and I'm pretty sure it's still the same. I think it's even more strict. So I get asked all the time, okay, well, is magnesium banned? No, magnesium itself is not banned. You can't inject magnesium. No injectable substances may be administered to a horse or pony within 12 hours prior to competing. There's also new rules about rectal dosing of so suppositories of any kind of substance cannot be done on a competition grounds. And in therapeutic fluids, so giving in IV fluids, which can only be done really by a veterinarian, and cannot put concentrated electrolytes, of which magnesium is one of them, into those fluids. But magnesium by itself in an oral form is not a banned substance. So in the formula Calm B, magnesium, thiamine, tryptophan, these are the key elements. So quite an amount of magnesium and tryptophan. Tryptophan is the hormone and amino acid that when you eat turkey, there's a lot of tryptophan in turkey, makes you tired after eating your turkey dinner at Thanksgiving. But it's that combination of magnesium and tryptophan. We have the Calm B paste either as a paste or as the powder. These are 35 grams syringes. We try not to use them, say, for multiple horses. It's the directions for use is 1 tube a day. It's a single serve tube, just like the foal paste is a single serve. Because what I have found with pastes is when you take the lid off and you squeeze a little bit out, and then you put the cap back on, and maybe didn't go back on very well, it sits in the glove compartment of your truck, and then it's under something and you can't find it, so you open another one for the next time, and then you find it again and you feed that a few weeks later, and then we get complaints in the office that, oh, it's hard and it wouldn't push out of the tube. Well, I believe that single serve tubes stop cross contamination, and they maintain the integrity of the product a whole lot better. So large amount of magnesium, tryptophan, and again, tryptophan, I get a lot of questions. Is tryptophan a banned or controlled substance? Absolutely not. But here is the kind of ideal, the ruling when it comes to any substance that you feed a horse when you're trying to compete it, that anything you add to the diet or give to the horse with the intent of using it as a competitive advantage, calming it down, masking pain, anything you feed with that intention is deemed illegal. There's no way to really test for somebody's intent, but I mean, I don't think that we should be feeding any supplements or drugs to mask either pain or terrible behavior anyway. Tryptophan is a naturally occurring amino acid. So serotonin, we call that the happy hormone, supports calm, balanced nervous system. That's why tryptophan's in there. Thiamine is a B vitamin. Lysine. Lysine is an amino acid that we really think about more when we think about muscle function, but it is also really critical for calcium metabolism, and also vision and overall well-being and mood. So all of these together, the lysine, the thiamine, the magnesium that we've talked about, tryptophan, pyridoxine, which is another B vitamin, these all work together to aid in calming of the horse if it's truly just got, kind of a bit of a nervous behavior. But before I go to calm B, I ask all of those questions, and the most common reason why a horse changes their behavior is gastric ulcers. So I typically say, hey, let's try some cool gut before we go to the calm B. Other supplements in our line that may be considered calming for different reasons. So the mare relief. The mare relief is really a herbal supplement for adult mares to help with some mares show their heat cycles and alter their behavior based on their cycle a lot more than others. Some it doesn't bother them. Some, that they're cycling, but they're not moody. Other mares, impossible to almost ride them. Again, you can start with a mild anti-inflammatory like yucca, because there can be some pain or inflammation over the loin of the horse, kind of behind the saddle. And so that can offer a little bit of pain. So even just something like yucca can be beneficial. But the mare relief has a variety of different herbs that haven't got a lot of research in horses, but we know in human medicine that these ingredients have been used for hormonal relief. So dong quai is a popular herb used for treating cramping, irregular cycles in women. Red raspberry leaf helps with uterine health and muscle relaxation, because a lot of the times they change their behavior because their muscular system is cramping in the uterus. So it helps with some muscle relaxation. Chasteberry extract actually affects the brain, and so can then alter hormones signaling behavior changes as a result of their reproductive cycle. Then there are some other, placental substance which has been shown to balance hormonal fluctuations, whether it be elevated progesterone or elevated estrogens, causing some of this behavioral change. And then these calcium, chrysin, indole, supports the relationship between those, primarily estrogen and progesterone. I'm not saying that you feed mare relief to every mare and it's going to help. It may help with some. It may not help with others. It's one of those that you really just need to try on your mare. But with a moody mare, this may be something that can help with that altered behavior during her cycle. One of the other key reasons why a horse might change their behavior is the type of calories that you're feeding the horse. So if you're feeding them a lot of energy coming from those sugars and starches like barley or corn or even oats, we know that that type of energy can alter the behavior via the microbiome. So decreasing the sugars and starches in the diet and increasing the oil, the calories coming from oil or fat, i.e. adding DAC oil, can also, we call oil or fat a really slow release calm energy. So that has also been shown to help with behavioral changes. This was back in 2017, magnesium sulfate. So I did get, people would send me this and say, oh, magnesium's banned. No, magnesium sulfate as an injection is a controlled substance, but it is absolutely not a banned substance. This one, I think when I first put this presentation together, there was a whole wave of people that had been using gabapentin, um, and it was in the active ingredient in a supplement called Carolina Gold, and horses were actually having almost like heart attacks, and a couple of horses actually died. So, we've got to be really careful about what we're supplementing horses with, and when in doubt, I would say don't feed it. Valerian is in valerian root, because we also got to look at like the active ingredients. You may see something written on a tag, but then the active ingredients or the extracts of that, if you dig a little deeper, may actually be what's banned on the banned substance list. So what I want to do is I want to pull over this here. So the FEI banned substance list or clean sport list. Let me bring this over here so that you can see it. I just typed in FEI clean sport, and all of our governing bodies, whether it be USEF, Quarter Horse, everybody really, the overall overreaching body is the FEI. That's the Federation Equestrian International. And if it's banned with the FEI, it's typically banned with these other groups as well. So we've got banned substances and then controlled medications. Controlled medications or substances are shown to have a therapeutic value and often used in equine medicine, but we don't want to be feeding them whilst we're competing, because they might have a performance enhancing effect, or they might be really good at masking pain or discomfort, and that becomes then a welfare issue. And then there are just substances that cannot be fed ever. There's been quite a few changes recently this year, and I think I can bring those up too. But if you go from here, you can click on the Clean Sport for Horses. Okay, so we can click on Clean Sport for Horses, and then that takes you here. Yes, I agree. And then if we look at the prohibited substances, we go down. Go back here. Here, Clean Sport, and this is a database. You can actually just type in what you're asking about. So one ingredient that we have in one or two of our products is Devil's Claw, and Devil's Claw is in the Herbal Respond Devil's Claw extract, and Devil's Claw is actually a banned substance. So let's just put it in here. So we typically will see it as Devil's Claw or Devil's Claw extract, but it is, that's that long word there, Harpagoside. And it can have an analgesic-like effect. So it's a controlled substance. It's used in relief pain and inflammation, and there's probably going to be a withholding period prior to competition. So Devil's Claw is in the Herbal Respond. That is the only product, I think. Somebody else can type in if they remember Devil's Claw being somewhere else. But I'm pretty sure that is the only place that it is. And so the Herbal Respond is the only product in the catalog that you could not feed while you were competing. If you want to type in other substances that you might be interested in, we can type them in and everybody can see them. So key changes to USEF. So most of us are under that ruling that have just kind of been expanded for 2025. Significant changes to its banned substance ruling, including a ban on rectal administration of any substance at competition grounds. I didn't even know that joint supplements could be administered rectally, but today I found out that there is a joint supplement that's a suppository and people give it rectally. the prohibition of certain injectable drugs like ACTH and magnesium sulfate. Again, we're not allowed to do any injections on site, and the introduction of hair testing for detecting substances such as barbiturates. So I often get asked the question, I'm going a little off topic here, about the hair testing and is it good for looking at the nutrient profile of a horse. And really it's not. It's not good at determining whether the horse has enough calcium or phosphorus or whatever actively in their blood or in their body, but it is used to look at the use of heavy, if they're we suspect heavy metals. It's good for looking at that, but also for looking at drugs. So hair testing can actually be pretty good for looking at drugs in the body or the presence in the past of drugs. Okay, rectal administration. I'm going to put this over here too so you can see this. Injectable substance ban, ACTH, these here, melatonin, oxytocin, thiamine, tryptophan. These are all thiamine, tryptophan. Thiamine's a B vitamin, tryptophan's an amino acid essential, but not injectable. So injectable is just really not good at any time. CBD, any CBD, THC, cannabinoid products are still prohibited. The USEF puts out statements say they caution against the use of herbal and natural products because of their ingredients and properties can cause positive drug tests. This is where I say the NASC logo is really important because of their rigorous testing. A lot of the times natural substances or substances that are manufactured in small facilities or human facilities, you would think, oh, it's manufactured in a human facility. That makes it even better for us. Human facilities don't have the same restrictions on things like caffeine, for example. Like how much caffeine has every single person on this webinar consumed today alone? Caffeine is a banned substance. You cannot give a performance horse any kind of caffeine. So one of the most common contaminants in supplements is actually caffeine because it's just so widely used in a lot of supplement facilities. So when someone says, oh, we have a human grade facility that we're manufacturing our products, that actually isn't a great thing when it comes to horse supplements. What we want to do is work with facilities that have limited usage or no usage of these banned substances, so that there's just no cross-contamination or accidental cross-contamination. So we've got a question here. I appreciate you all being on. I'm going to stop the recording now so we can go into those questions.